reason I'm so happy to be here in Maine is because I know that quality really counts. It's the difference between sickness and health, and life and death. And that's why we're all here. And that's why those of you who are in the healing professions of medicine and nursing, it's why you went into these professions. And this work is about rekindling that and keeping it alive. You know, I thought for many, many weeks since I received this very gracious invitation from Quality Counts to come here, what can I possibly say to Mainers that you don't already know? You're already a very sophisticated group of people when it comes to healthcare. You're already leading the country in patient-centered medical home implementation. You've made such strides in price and quality transparency. You have exquisite pockets of transformation that has taken an enormous amount of work to achieve. And you're engaging members of the public in this work of transformation. So what can I possibly say that you don't already know? As I thought about that, I thought, well, I should just tell you what I've been thinking about and what I've been doing. And that's been sort of looking ahead at where we are headed. I learned from Dr. Paul Batalden, who ran what we affectionately call the summer camp at Dartmouth for quality improvement leaders in academic medicine, nursing, and healthcare administration. And the one thing I learned from Paul, and as those of you who are involved in the work of improvement, that it's about defining your aim and where you want to be. You have to have that aim and that destination in mind, and then to lay out the plan for the journey. So in this talk, I'm going to look ahead, where we are headed, and bring all of us together to think about what we need to do to reach that destination, to preserve and protect the goodness that you have co-created together. Some of you know that I donate the proceeds of the books that I write and the honoraria that I receive to patient groups. And I do that because in my journey, they have taught me so much about healthcare, our system, and how we can make it better. As a result of that, I can say things that need to be said, that I know that are in the hearts and minds of many people who work in healthcare, the things that are said privately at dinner or whispered at meetings. Because I believe we have to make the invisible visible if we want to fix it. We have to talk about those things that are hard to talk about, because if we can't talk about them, whether it's in our families, places of work, our country, or our world, we can't fix them. And I learned from the work of patient safety about working on end-of-life care that if we speak the truth, people will pop up. As Mahatma Gandhi said, whenever there is a good cause, people just pop up. And you are popping up. So that's my job today. And as Dan said, I have planted seeds for Maine in my house, and I'm waiting for spring to really arrive. And I hope to leave some seeds behind, seeds of change here in Maine. I have a very boring life, and I look around at reports like from the Congressional Budget Office, and it's amazing what you find. And if there's nothing that you remember from this day, this is it, ladies and gentlemen. This is a graph from 2007 from a Congressional Budget Office report tucked away in Appendix D, the last page. I really think they didn't want anybody to see it. And it shows the future. Based on historical spending trends, if they continue, we'll be spending all of our national income, our family income, our state income on health care. Now, there have been some moderating trends in the post-recession period. Who knows if they're temporary, and that may bend the curve a little bit. But you know where it's headed. And so what does this really mean? And Dan started talking about it in his opening remarks. In our every deliberation, we must consider the impact of our decisions on the next 7 generations, even if it requires having skin as thick as the bark of the pine. There is a notion in economics called opportunity cost. It means if we're spending money on something, we're foregoing the opportunity to do something else. So what are the opportunity costs of spending so much of our income on health care? We've been doing it implicitly, and now we need to make it explicit so we see the choices that we're making. And in fact, there are many people in Maine and around the country every day who are making those choices about medicine or food or heat. This is the grammar school I attended in suburban Long Island, New York. And in the right-hand corner was my kindergarten classroom. And I remember Mrs. Damon. And I remember those first days walking to kindergarten with my mother. She was holding my hand, and I would get sick along the way because I was so scared. I hated school. And I look back on that community of 30,000 people, and I was sad to hear that last year this school closed. And I was following the notes, and I haven't lived in this community for a very long time, but it's just an interesting microcosm of the world. And the notes of the school board said that, well, state aid had declined. This was during the recession, and there was some downturn in enrollment. But they also talked about the increase in health care costs in the school district. And then this year, I kept reading the notes of the Baldwin School District. And what I learned was now they're going to have to lay off 15 teachers. And healthcare spending in 1 year had gone up 27%. So what's going to happen next year? And the year after? And the year after that? Where are we headed? Are we going to have the money to plow the streets when it snows in winter? What are the trade-offs we're making in higher education, in basic community services? What trade-offs are being made now? So I'm driving around and I hear the monthly U.S. Labor Department unemployment figures, and they say, oh, the sectors that have grown are healthcare. That's good news. But then what about those teachers who don't have a job? Because healthcare spending is increased in that community 27%. Where are we headed? Do we need to install some red lights? If so, where would you put them? How would you put them? I think this is one of the most crucial conversations we need to have in this country.